Do you know stroke, which is like a half body paralysis, is in this era seen in the younger population, 20s, 30s, 40s age group coming with weakness of arms or legs. I'm Dr. Namita Kaul. I'm the Principal Consultant Neurology at Max Hospital, Vaishali. Stroke occurs when the blood supply to the brain gets obstructed. So depending on which region the supply is affected, those cells get damaged and lead to subsequent effects, which can be loss of function of a part of body like speech, vision, movement of a particular limb. Because of this, there is widespread social, physical, mental impact as the patient can't move, his routine gets affected. Traditionally, we have seen that a stroke would occur in the elderly population, and 80% of the strokes occur in more than 50-year-old age group. However, 20% are now occurring in less than 50, less than 45 years, and these are labeled as young strokes. Young strokes was the incidence over time we have noted in the 2000s has started increasing. More so after the COVID era. So last 3-4 years, a lot of patients in 30s, 20s come to us with strokes. So what causes stroke in the young? Well, the most common factors remain the same as in the elderly. Anything which affects the blood supply to the brain can lead to strokes. So high blood pressures, uncontrolled cholesterol, smoking can affect the arteries and lead to strokes. In young especially, drug abuse is a very common cause which affects the arteries and leads to strokes. Then there are certain genetic conditions in which the blood gets thickened or the artery gets thick and hence the blood supply gets affected. This can be evaluated on blood tests. There are certain other rare causes like heart problems, which are usually seen in the young, valve problems. Here, a blood clot is formed in the heart and this migrates to the brain, leading to strokes. Then post-pregnancy, sometimes the blood gets thickened and this can lead to strokes. Then there are certain rare conditions, rare infections where like tuberculosis, HIV, which can affect the circulation. And more recently, viral infections, which lead to blood thickening. The SARS virus, the COVID virus, even the vaccine led to thickening of blood and the increased incidence of strokes in the young. Rare possibilities are autoimmune diseases, which can be evaluated by the doctors. Stroke, as the word itself says, comes in suddenly. There's no small symptom or something which will come in first. In such a case, the symptoms that you usually see are balance issues, eye problems. There's a wonderful mnemonic for it. So B fast. B is for balance issues, dizziness, drowsiness. E is for eye problem like double vision, vision problem, loss of vision. F stands for the facial asymmetry, if there's a twist in the face. A stands for arm or leg weakness. S is for speech problems. So any of these problems, if they come in suddenly, then one should understand it might be a stroke. And the only way to diagnose it, to urgently go to an ER, emergency room, where the doctors will be immediately able to diagnose it through the MRI or CT scan. The most important part in the treatment of stroke is to reach the hospital on time. In this era, we have strategies to reduce the impact of stroke, the loss of blood supply, by giving intravenous clot busters through injections, or even through angiography. The clots are removed by putting a wire inside, which it is called thrombectomy. But the important point in this is that these strategies can be used only if you reach the hospital within 4.5 hours of starting of symptoms. Subsequently, if the patient reaches on time, all these interventions are done and we improve the chances of a normal life of the person to become normal by almost 60%. After that, a proper hospital care, a stroke unit care can help in better recovery. In this video, we have learnt that stroke can strike anyone, any age group. Be fast, recognize the symptoms immediately and reach the hospital on time, because on timely management can completely cure it. And always remember, even if the symptoms get resolved on their own, you should immediately seek medical help, because the symptoms can come back in 24 hours. And best of all is prevention. Take care of your lifestyle. Stop the cholesterol, stop the smoking, control the blood pressure, healthy lifestyle, physical exercise, and happiness. And you will never see such things again. I hope you found the video informative. If you have any doubts or questions, please comment below. Thank you.